Hello, everyone. I'm Neyrian from Brazil. Don't worry to pronounce my name correctly, because even in my country, my name is unusual, so I have to spell all the time, so don't worry with that. I'm a professor of nursing teaching in a public Brazilian university in Maranhão State. I work with mental health. I teach and research in mental health, and also I'm doing some research on skill mix and collaborative practice with José. So this is my background. It's such a great pleasure to be with here today. Thank you.
Thank you, Jose.
Thank you, Neyrian. And hi, everyone. I am Jose Rodrigues. Also, I'm from Brazil, and I have a degree in pharmacy and a PhD in Interprofessional Education from the University of São Paulo. And today I represent the Regional Network for Interprofessional Education in the Americas, REIP. So for me, it's a great pleasure to introduce Neyrian. She is who is going to talk to us about the interprofessional education and the collaborative practice and integration in health and education policies in Latin America and Caribbean. So I think it's this is a subject, and we should be interested because we will be able to learn how the IPECP and can contribute to the development of education and health policies in Latin America and Caribbean, especially in the challenging period of the pandemic. So, Dr. Neyrian Fernandes is a nurse from Brazil, and she's worked with me and the World Health Organization at the Pan American Health Organization, PAHO, in Washington, United States, when we are able to discuss about the IPECP, and other topics such as skill mix. So Neyrian is a professor at the Federal University of Maranhão, and she will tell us about the IPE plans of the countries of Latin America and Caribbean, as well as the process of creating of the regional network for interprofessional education in these Americas. So I would like to thank the Global Confederation for Interprofessional Education and Collaborative Practice, through my colleague Richard Pitt and Joanna, for this Global Interprofessional Café and for this opportunity. So welcome, Neyrian, and I will share our presentation.
Thank you, José. And welcome, everyone. Now I can see some new people, some are my students. So welcome to this presentation. I hope we can exchange experience and knowledge today. So thank you, José, for introducing me. As José told you, I am Neyrian, and I'm honored to be here today. So we met, me and José, we started to work 3 years ago at PAHO in Washington, D.C. And in there, we started to do some research on skill mix and collaborative practice. And I also followed him in some presentation about the REIP. So the next one, please, José. So the objective of this presentation is to show an overview of Latin American countries' interprofessional education, IP, plans, the creation of the regional network for IP in the Americas, and the influence of the COVID-19 pandemic on the implementation of interprofessional education in these countries. Next, please. In this presentation, we will give a background to show the motivations or reasons to create an interprofessional network, to understand its mission and vision, and also to highlight the interprofessional network as an important tool to share information and experience, and also to shape education and work policies in these countries. We will see how it is structured and the strategies adopted in those countries, the outcomes, aims, and in the end of our presentation, we will give some insights on the influence of the COVID on the implementation of the interprofessional education and collaborative practice in Latin America countries. Next, please, thank you. So in here, we can see a short timeline of the IP network in the Americas. So our landmark, we can call our landmark, was in 2016 when PAHO and WHO held the first interprofessional education in healthcare. It was a regional meeting held in Bogota, Colombia, to support countries in Latin America to implement or strengthen the interprofessional education and practice. So it was in 2016. So we are a very young project. Next, in 2017, on September, the PAHO launched the Strategy on Human Resource for Universal Access to Health and Universal Health Coverage, to encourage countries to promote the development of the interprofessional collaborative teams in integrated health services networks and using interprofessional education and practice. It was a very important launch and publication to direct this network in Latin America. In 2017, still in 2017, in the regional office of WHO for the Americas, the PAHO Human Resource for Health Unit launched a technical cooperation strategy to support Latin America countries in implementing interprofessional education and practice in the human resource for health policies. This strategy was mainly focused on networking, research, sharing of experiences and activities, such as regional technical meetings of the interprofessional practice, and guidelines for the creation of the IP network. Late on December 2017, we have the second regional technical meeting on interprofessional education practice in Brasilia, this time in Brazil, to formalize the network. This event, organized jointly with the Ministry of Health of Brazil, and was attended by representatives of 22 countries from the region. The purpose of the meeting was to discuss process for incorporating the international practices, collaborative practices into policies of human resource for health, to establish a common agenda for extracting IP in the region, and also to foster the preparation of national action plans to implement this approach in the region. So it was created the REIP, having Argentina, Brazil, and Chile as member countries of the network, and they were executive secretary of the network in Latin America. Then in 2018, the third meeting, Interprofessional Education Healthcare in Argentina, happened in a more advanced process of implementing the IP plan in some countries. It was 3 years late, so the countries, they had results to present, to discuss, and to show in this meeting. And the fourth meeting was planned to be held in Chile, but because of the political crisis in that year, this meeting didn't happen. So we had another meeting in 2020, the fourth meeting, and it was held in Uruguay. And because of the pandemic, we had a virtual format. So currently, the REIP has 19 member countries, and these countries are committed to drawing up plans in education and healthcare policies ranging from the micro to macro level of policies. Next, please. So the regional network in the Americas constitutes a strategy among countries interested in the development of interprofessional education with a view to improving the quality of health services and enhancing the education of human resource for human through the work of interprofessional teams. So we like to highlight that this is a strategy to shape the education and healthcare in the Latin American countries. Next, please. So the REIP aims to propose activities for developing IP within the context of universal health, to share or provide a forum for the exchange and dissemination of IP information, including experiences, knowledge, and scientific evidence. Also to accompany the status of IP and related trends in health. To identify common IP facilitators and barriers, to strengthen the development of intersectoral and multicenter research, to support the articulation between interprofessional education and practice, and finally to help and support countries' activities related to the interprofessional education and practices. And next, please, José. So we consider essential to understand that the REIP was created in a cooperative and cooperative process among the countries. That's why the mission and vision of the REIP is so important to know and to understand. So the mission is to cooperate with the countries of the region of the Americas to develop and advance toward interprofessional education and collaborative practices in healthcare. And the vision is to coordinate and share experiences, knowledge, and the production of scientific evidence on interprofessional education. Mainly, this is a highlight that is to support policies that contribute to universal health in the Latin America countries. So the next one, thank you. There are 19 countries with action plans for IP. So the next one, please. We are showing here, I think, 18, but right now we have 19 countries. The last country to join as a member of the REIP was El Salvador. Am I right, Jose? Is that? Thank you. The next one, please.
Just a minute, please, Neria.
Okay,
Exactly.
no problem.
El Salvador, the last country with the joint REIP.
Yes, the project is still under construction in the continent and the countries. So the impact of these plans right now is that 19 countries in the region of the Americas submitted the action plans to implement interprofessional education in health for the period of 2018 to 2023. And those plans are divided in 4 sections or sections of activities. So the first one, we have studies, dissemination and recognition of the IP. The second is interprofessional faculty development. The third is the IP in continuing education program. And the last are the legal mechanisms. So all the activities listed in those plans are classified in these 4 sections. So in here we have the 19 countries and the actions in each step. So now we have the next one, please. So all the countries now, they have studies, dissemination, and recognition of the IP. This is because all those 19 countries, they are looking for to comprehend and also to appropriate the theoretical system that regulate the IP. So all the countries, they are looking for that. The next one, we have the interprofessional faculty development. So this one, we only have 1, 2, 3, 4, 5, 6 countries that developed some actions in this interprofessional faculty development. So this is one point that we need to focus because to include the faculty, the people that give education, it's very important to implement the plan. The next one is the IP in continuing education. So we have a little more than the half of the countries. 10 countries have this one. And the last one is the legal mechanism. So also have consider a number of countries that are worried to implement and also to assure the continuation of those practices, of the professional practices. So this is the situation we have right now. The next one, please, Joseph. So now we have a summary of the plans we have right now in the Latin America countries. So we can see here that all the 19 countries, they have activities related to study, dissemination, recognition of IPE, like meetings, workshops, and events related. So this is present in all the country members. Then we have the second most implemented activities is in yellow here, is the IP in continuing education program. The next one are the legal mechanisms that is still implemented, and the interprofessional faculty development that need to be improved in more countries or implemented in more countries. The next one. So now we have a trajectory, a historical trajectory of the REIP. So the REIP has a website of the Regional Network of Interprofessional Education of the Americas, and it was launched in Cuba, Cuba Salud 2018. So we have this website. The next one, another event in Colombia holds the second national workshop on interprofessional education, IP. Also some publications on interprofessional health education in the region of the Americas. So this is a recently editorial published in a Brazilian journal. Thank you. Also, the new administrative technical standard of health programs for adults and the elderly person in Panama focuses on interprofessional education. So this is an experience in Panama. In Argentina, they had the importance of the regional network for interprofessional education in the Americas from the international health perspective. Then the Learn Teamwork in Health from undergraduate. This was in Chile. The next one, in Brazil, we had the theme of interprofessional education present in the largest education health event in Latin America. And also in Brazil, launches online course on interprofessional education in health. And also REIP is theme of an event in Argentina. And also those are webinars held by the REIP and also PAHO and WHO. And this was, Brazil holds an event to evaluate courses in faculty development for interprofessional education in health. And Cuba holds national meeting on interprofessional health education. And a workshop planned for the implementation of interprofessional education in Brazil, analysis of results achieved and discussion of new lines of action. And finally, the influence of the COVID-19 pandemic on the implementation of IPCP in Latin America. So in Brazil, we have this program for education through labor for health that we call PET Saúde. PET Saúde launched more than a decade ago. It was in 2008 and is one of Brazil's great programs related to REIP. It brings innovation to sustain the interprofessional practice in the country. This program presents evidence that the SUS is a health system that enables the development of sustainable interprofessional teams due to its own conformation that involves different health professions, professional in practice. So we have 120 projects last year that ended in last April. And because of the COVID, all the projects had to adapt to the situation. They had to reshape to make the project continue in the virtual format. So it was a challenging to the Brazilian country. And also in Colombia, they have experiences like that in the University of Santander. So they are giving virtual meetings and lessons, including all kinds of different graduate students. Next one, please. So the regional network IP in the Americas, so we have some outcomes. Embedding of the IP in the human resource policies of countries in the 19 members country with action plans. IP was not well known in the Americas so far, but with REIP, IP has begun to be recognized and acted upon. Through researches and also symposia, meetings have served to raise awareness of IP in the region. Next, please. So some strategies for advance of REIP to support the development and implementation of IPCP in the Americas. First, to support implementation of IP policies in the countries. Also, quality improvement initiatives of IP and CP. Support for IP leadership development in the Americas, and increase of number of member countries of the REIP. So we still have some countries to come. The next one, please. So now this is a video related to human resource for health in the American countries.
Maria, I think it's not possible to use the video now.
Yes, I had this problem. I don't know if it's working.
Please share if you can.
Yes, I think we can share so that people can watch that. And thank you everyone for listening. And now we are open to question and discussion.